Well, good evening, everyone. I want to welcome you to Ask the ARC. Thank you so much for coming tonight. My name is Carly Shortino-Poulter, and I'm the director of the ARC Advocacy Network at the ARC of Indiana. And I have to admit, I'm actually really excited about tonight's topic. Self-directed care is a brand new service that's available through the Family Support and the CIH waivers. And I think that this is something really exciting. There are a lot of ideas behind why individuals may want to choose self-directed options. And one of the biggest reasons is that it may actually help open up um, a greater workforce and a more consistent workforce available to people. But there are a lot of different parts to this, and I'm excited that we have a special guest speaker tonight. Heather Dane is the Chief Program Officer at the Bureau of Disabilities Services. She is previous to this role, she served as the Bureau's Home and Community-Based Services Director, as well as the Family Engagement Specialist. She's a Life Course Ambassador and is in fact the state's Life Course Facilitator. Through her education, years of professional work experience working with families, and most importantly, as the parent of two children with multiple disabilities, Heather's able to provide the Bureau with a perspective that is unique to families, and she strives to improve family professional partnerships, which enhance access to the complicated systems and services that assist families and individuals in identifying, communicating, and working toward their vision of a good life. I'm also really excited because Heather is great at being able to explain things, especially really complicated things, in a very accessible way, in an easy to understand way. And let's be honest, things are not always very easy to understand in our world. And Heather is great about making things tangible and accessible. So Heather, thank you so much for joining us tonight. I do want to remind everybody that we are recording tonight's webinar and it will be posted on the ARC's YouTube channel. I also want to remind you to go ahead and put all of your questions in the Q&A. With this being such a new idea for the Family Support and CIH waivers, I think we will likely have a lot of questions. So go ahead and put those in there, and we will get to your questions as we go along.
All right. Thank you, Carly. I just shared my screen, so just want to make sure everyone can see it. And thank you, Carly, for such a gracious introduction. As I'm going through the slides, I have, several slides to kind of go over with you and introduce you to the option for self-directed services, which I'm really excited to have this option available to individuals and families now. But as we're going through, if something I say doesn't make sense, please feel free to throw a question in there. If it's kind of a more general question, I might answer it more at the end. But so yeah, today we're just going to dive into all the self-directed services that are available as of December 31st. And so it's going to be a high-level overview of what self-direction is, what you need to know when choosing to self-direct, and how you can get support in planning and for using your self-directed services and budgets. So let's go ahead and jump in and get started. So Carly gave you kind of a good overview of what self-direction is, but just to kind of reiterate, it's really self-direction is a service model that gives you more choice and control. So you get to decide who provides your support, when, and how. And so it really is about building support in a way that fits your life. So Indiana's program now includes two different kinds of authority. So when you hear people talk about self-direction, they'll talk about budget authority and employer authority. And so we built in the authority for both. So employer authority is hiring and supervising your workers, and budget authority means managing the wage and the service budget. So basically that means you hire, you pay, and you manage the people that support you rather than going through a provider agency as you do now through the traditional model. So let's talk a little bit about the core values of self-direction. And so, these are things that we worked within the state with a number of people with lived experience to really talk about what are those core values of self-direction. We looked across the country and at different services or different self-directed services and supports that are available across the country, and we really wanted to create those core values that drove us to ensure that what we are doing really does these things. So one, that it provides choice and control. And so this means that the individual chooses who supports them. Self-direction is having the power to make decisions and be in control of your life. And so this includes being provided all the information necessary to make those informed choices. It also includes access to the information needed to make those informed choices about how and with whom you want to share your life. The power to make your own choices. Oh, there you go. Sorry, my computer was locking up on me. The power to make your own choices includes the authority and responsibility to manage your own budget and to hire people you want to provide for your supports. When we think about disability or dignity, respect, and rights, it's basically, it's that core belief that we all have, that all individuals have the right to direct their own life. So you have the right to be treated with dignity and respect. You have the right to share your skills, your talents, and yourself with your community. You have the right to take risks and to make mistakes and learn from them. That's a big one, especially in, when you talk about service arrays and accessing services. We all make mistakes and we all learn from them, and people with disabilities have that same right. You have the right to be part of your community. You have the right to give and receive information through all methods and forms of your expressive and receptive communication style. And all supports should be delivered based upon what you have defined as your vision for your life. And then interdependence and autonomy. So that really is speaking to that we encourage that personal growth. We support people to lead more independent lives. And self-direction really provides the flexibility and that equitable access to supports that enable individuals' autonomy in their employment, their housing, and social opportunities. So we also recognize that a person's interests or needs change, and as those happen, so should the services that support them. So now that we've talked about some of those core values of self-direction, let's talk about what services are available. And so, or what services are available to self-direct within the waivers. So we now offer, with BEADS, we administer 4 of the 5 waivers that you see on your screen. So the family support waiver, the community integration and habilitation waiver, the traumatic brain injury waiver, the health and wellness waiver. And then our partners at the Office of Medicaid Policy and Planning, they administer the Pathways for Aging waiver, who has also modeled their self-directed services after the health and wellness waiver. So that way we have that continuity of care. So as a person is moving from health and wellness to Pathways for Aging, they still have the same self-directed options available to them. So we know not always do you even know which waiver that you're enrolled on. That sometimes, even that, the name of your waiver can be confusing. So if you're not sure which waiver you're enrolled with, ask your case manager or your MCE service coordinator and they can tell you. So what services can be self-directed? So here on your screen, you'll see how we've broken down based upon the waiver, what services are available. So on the health and wellness waiver and the traumatic brain injury waiver, you can self-direct your attendant care, your skilled respite, or your home and community assistance. And so health and wellness and traumatic brain injury waivers are for those who meet nursing facility level of care. For traumatic brain injury, that is individuals who have a qualifying traumatic brain injury. And they may also meet the intellectual and developmental disability level of care to access that waiver. But those services are very similar on the health and wellness and TBI waiver. And so as you can see, those 3 services are available on each of those waivers to be self-directed. On the family support waiver, you can self-direct your participant assistance and care, which is also known as PAC, your respite, or your workplace assistance. For the CIH, or the Community Integration and Habilitation Waiver, very similar. You can self-direct your residential habilitation and support hourly, so not daily, but your hourly service. And you can self-direct respite or workplace assistance. You'll see for the Indiana Pathways for Aging, that is for the 60 plus population who have that nursing facility level of care. They can self-direct their attendant care, skilled respite, and home and community assistance. So depending upon what waiver you are, these are the offerings of services that you can either choose to do the traditional model through a provider agency, or you can choose to self-direct. And so we'll talk a little bit more about that in detail. So choosing to self-direct is really, it's a very personal choice. It's not for everyone, right? Because with self-direction comes a lot of responsibility. And so we have developed a number of different resources and tools available to you to kind of explore to determine, is this right for me? So if you get on our website, and maybe Carly can throw that website in the chat for you all so you can access it easily, you'll see there's kind of an exploration tool for individuals. There is a toolkit for individuals, which kind of talk a little bit about what self-directed services are and what the roles and responsibilities would be. There's a fact sheet. So there's just a number of different things on there. But also know your case managers have all received training on this as well. They have all of those tools available to them, as well as a case management guide around self-direction, as well as a training specifically for them around self-direction. So they really are available to help and support you through making this decision. And so I talked about the self-direction exploration tool. And so this is one that you can start to fill out. And this is not a test. It really is a decision-making tool. You don't have to prove that you are eligible or that you are able to self-direct. That is assumed. And so what this tool does is really just kind of asks all of these questions to say, are these things that you are able and willing to do? And you can say yes or no. And it really just helps you to kind of decide whether or not self-direction is appropriate for you. So it'll say things like, do I want to choose my own workers? Do I feel comfortable planning my services? Do I want to be in charge of my workers? Some people don't like having to hire and fire staff. Some people don't want to, that accountability piece when you have staff. And so it's asking you all of those kinds of things. It also helps you think about things like, do I already know people who I could hire? Which might help you. It'll also, you don't have to hire someone that you know, but sometimes it's helpful or an easy way to get started. But there are lots of different ways that people go about finding staff to hire through a self-directed program. So again, please keep in mind when you're looking at that tool, it's not a test, it's not a pass or fail. You don't have to turn it in to get your plan approved with self-direction on it. It really is just to help you make a decision that's right for you. So let's talk about some of the different components of a self-directed program because, as I've talked, there's a lot of things that go into being in charge of your own services and your own budget and your own staff. And so, but there are supports to help you to do that. So, I've already mentioned your case manager or your service coordinator if you are with Pathways for Aging and have an MCE. They are definitely there to support you and help answer your questions. There is a fiscal management service. It's called an FMS that is available to you, and that is required as a required piece of self-direction. And so we'll talk about that, but they really do support you with things like payroll and taxes, all the things that the average person can't do, nor do we want to, right? And then you can also have a representative. So you can have a self-directed representative who helps you to make some of those decisions and works through some of those employer responsibilities. So we'll talk about each of those different roles and responsibilities here in just a moment. So then let's first talk about what your responsibilities will be. So you are first and foremost in charge of finding and hiring your self-directed workers. So this may be things like writing a job description, doing all the interviewing and the hiring process, deciding how much you want to pay your workers that fall within your budget, and wage limits. And so we'll talk about what those wage limits are in a little bit, but also all the training. So training your self-directed workers on how you want to be supported. There are some requirements of staff, some basic training requirements of staff that we will talk about, that they'll have to go through depending upon the waiver that they're on. But as far as that person-centered planning training, that really is up to you to do that, to talk about what are your support needs, and how are they going to support you to do that. So in addition to that, you'll be in charge of managing your workers. And so you will have staff that you will have to set and monitor work schedules. You'll have to think about things like backup plans if someone calls in sick or isn't able to come. You will be responsible for reviewing timesheets, because they will submit their own timesheets to that FMS, that financial management service. You'll be in charge of supervising them, having a backup plan if they can't work, and also firing them if necessary. So, if you hire someone and they're just not working out, it's up to you to determine, do you have kind of a conversation with them and do maybe a formal type of write-up? Do you just fire them? All of those things are really up to you as managing your self-directed worker. And then also you are in charge of your budget. And so this will be things like knowing how much is in your budget, watching how much you're spending each month. And so there's some tools to help you to do that, and staying within your self-directed budget. So you keep in mind, when you choose to self-direct, that yearly budget that is determined for that service, that has to last that entire year. So overspending can't be a justification for an increased budget. You can't, be 7 months into your plan and say, oh, I've paid too much, or I've used too many hours, and I don't have enough money in my budget anymore, so I need to add more money. That's not an option. You'll have to be able to think about and plan for that entire year of how your staffing is going to work, including things like overtime. So you'll have to think about that as well. So, but again, we have some tools to really kind of help support you and work through that. So we're going to talk a little bit about representatives, because a lot of times, getting support with self-direction, you don't have to do it alone. So you may need or want support to self-direct your services. And so you can choose someone to help with those services, and that's called a representative. So you would have a self-directed representative. So this can be a friend, family member, or someone else you trust. Keep in mind, they cannot be compensated for this role, for acting as the representative, and they also can't be the paid caregiver. So you'll want to keep that in mind if you are designating a person to be a representative, to kind of speak on your behalf, or to really help you with the self-direction services. They can't be paid and they can't be compensated for that role. So if the individual, also the other thing to kind of keep in mind is, if the individual in waiver services is an adult with a legal guardian, the guardian will be deemed the representative automatically. And so if a person has gone through the court system and it's been deemed necessary that they need to have a legal guardian, they will then and they want to self-direct, they can still choose to do that, but the legal guardian will be deemed the representative for that. That's the same for minor children. So the parents will be designated as the representative in that case. So for using a representative, you want to make sure you are connecting and naming someone you trust to help manage your services. And so they can do things like help you with the hiring and training, managing your budget, filling out paperwork, all of those types of things. They can also help you with challenges that come up. So, having some of those hard conversations with staff if they aren't necessarily completing their responsibilities as you would like. Sometimes those can be hard conversations, and your representative can be the person to help do that as well. So a representative must be at least 18 years of age. They have to understand your daily support needs, your healthcare needs, and your medications. They have to understand your schedule and your routine. They really need to attend the meetings, and they will receive copies of all notices and reports. And they, obviously have to be willing and able to complete the responsibilities of a representative. So again, the legal guardian of an adult or the parent of a minor will automatically be deemed as the representative. So, and they cannot be hired as your self-directed worker, so they cannot be your staff. But this can be a really nice option if this is something you really want to do, but you don't feel like you can handle all of the responsibilities with it. If you have someone you trust acting as your representative, they can be a really great partner in the process. There is also in that exploration tool, there are 4 representatives to kind of go through and answer questions as well, which will help them, to kind of determine, is that something that they can and are willing to do. So then when we think about the case manager or the MCE service coordinator responsibilities, so all case managers are required to give you information about self-direction. So they should, at your annual meetings, make sure you are aware of your self-directed options and help explain those to you if you want more information about them. They can help you fill out that exploration tool. They will add those services to your plan, so they'll help you figure out that budget. They'll help you fill out the self-directed services worksheet, which we'll talk about, which is a really great tool to help you kind of figure out what is going to be my budget and how much could I spend on wages and what does that translate into hours or vice versa. If I have to have 40 hours a week of help, then this is what I could pay based upon what my budget is. So it's a nice worksheet, and I'll give you some kind of screenshots and walk through that with you. And then they will also help connect you to the FMS, so the Financial Management Services. And we'll talk about them here in just a minute, but they are an excellent resource, and they have a great website as well that has lots of information. So, there it is. So there's their website that you can get on, and they have all the Indiana specific information. So the FMS is a really important piece of self-direction. It is a required piece. So just as you may be aware, if you have a waiver, the only service you are required to accept is case management, and all other services are kind of based upon your need and what you have determined necessary to support you. If you choose to self-direct, you must utilize PALCO, which is our FMS vendor that the state of Indiana has a contract with. And so the reason for that is they do all the regulatory and financial responsibilities. And so those are things like taxes, workman's comp. They do the background checks for you. They will set you up as an employer, so you'll be called an EOR, or the employer of record. They file and deposit all of those labor payments, forms. They track your spending. You have access once you enroll with them. They give you access to their system, so you can go in and you can see what have you spent, where are you. Their system is really user-friendly. You can review timesheets, all of those types of things. So this is really a critical part. This is across the country. It's a required piece of having self-directed services. So it's really kind of making sure that all of those payroll responsibilities, tax responsibilities, employer costs, all of those things are handled by PALCO, the fiscal intermediary. So let's talk a little bit about hiring and managing your workers and what the requirements are there. So, self-directed workers must be at least 18 years of age. They must be able to pass a criminal background check. And so, like I said, PALCO, the fiscal intermediary, runs that background check for you. That's not something you have to do. And then they also have to receive the required training. So everyone who provides direct support to individuals has to have CPR. And so that is true for self-directed services as well. So the CPR training, it is either your responsibility or you can make that the employee's responsibility to pay for and obtain that. So that can be part of the hiring negotiations that, well, I can pay you a higher rate, but you're going to have to pay for your own CPR. Or, if that's something that you want to pay for, it can't come out of the budget per se, but if that is something you want to pay outside of your budget, you can do so for that person. It's really up to you. But a person does have to be CPR and first aid certified. If you are receiving services on the family support waiver or the community integration and habilitation waiver, those services, the direct support professionals are required to go through a online training now. And so that is free, but they will have to register and complete and become certified through that training. And so it's about, if I remember right, about 6 hours of training total that they would have to do. They go in, they can do it on their own time, and they will have a certificate to show. And so PALCO, as the fiscal intermediary, will ensure they will not allow that person to start working until they show proof of completing that training. So for health and wellness and TBI, that training is not currently required, but it is offered to them if they want that as well. But it is only required for family support and CIH waiver. In addition, keep in mind that there are some limitations of who can be paid as your self-directed worker. So spouses may not be paid, legal guardians, or parents of minor children. They cannot be hired as the self-directed staff. So that is something that's written into our Indiana code. And it's with the idea that, those are the people who make those legal decisions over the individual. Therefore, because you can't be a paid representative, you also can't be a paid what's called LRI, legally responsible individual. So those are the only restrictions as far as who you can pay. So they must be 18, pass criminal background check, have CPR or other related trainings, and cannot be a spouse, legal guardian, or parent of a minor child. So then let's talk about what are their responsibilities of the worker who chooses to be your staff. So, they really should embrace the values and the ideas behind the self-direction model of choice and control, because you are going to be their boss, right? And so they need to understand that. They also should really understand that the individual representative is the employer. This can be friends, it can be family members, again, no parents, guardians, or spouses. But that anyone else who is a family member, that can be. So if grandma already helps out with respite, grandma can continue to do that, and you can pay grandma, what you would like to pay her out of that wage. My light's going out, so you're going to see me wave my arms real quick. Okay. They also cannot be the representative. And I think, we've kind of touched on that, but just to reiterate, and they also have to provide services and support in accordance with the waiver service definitions. So, you as the employer are telling them the types of support that you want. And if it's self-directed, let's say respite, as an example, they still have to fall within what that service definition says with respite and what those limitations are. Same way with all of them, with PAC, with ResHab, with attendant care. that person you are paying, they still have to fall, whatever activities they're performing have to fall within that service definition. Um, and then using your self-directed budget. So your person-centered plan will include the type and amount of services based upon your need. So the services in your plan you choose to self-direct will have a budget amount. And so this is going to be called your self-directed budget. So I'm going to talk a little bit about how that is determined and how that's calculated. So for each service that you choose to self-direct, so let me make sure I'm clear here. So you can self-direct, let's say you want to self-direct your respite, but you still want to use a provider agency for your PAC. You can still do that, right? So you can self-direct one or all of those services, but you can't have self-direction and traditional at the same time of the same service. So you can't choose to self-direct part of your PAC budget and do agency for part of your PAC budget, if that makes sense. You either have to self-direct the entire service or none at all. And so then the way that is calculated is depending upon the service that you're utilizing. Let's do attendant care now as an example, just so we're talking about all the different types of waivers and services. So if in conversations with your case manager, it's been determined that 40 hours a week of attendant care is what's appropriate to meet your needs. So they would take the 40 hours of attendant care, and then that's multiplied by the reimbursement rate, the state reimbursement rate. And then we subtract that by 10%. And so that 10% is the administrative fee. So I'll talk a little bit about why that is. And then that equals your budget. So number of hours times the reimbursement rate minus 10% equals your budget for the year. And so, and you can do that per each service. So then let's talk a little bit about, I'll tell you in a future slide how you find the rates, so you can kind of have a good idea. But let's talk a little bit about why there's a 10% reduction. So this is what the state holds back because we're responsible for the cost of that FMS vendor. So as we talked about, PALCO, who is our contracted FMS vendor, we have to pay them to provide that service. Their service that they're providing doesn't come out of your budget. It's something that we pay for. And so this helps offset the cost of what we pay. And so your self-directed reimbursement rates will include administrative costs that don't exist when an individual is the employer. So what that means is when you look at the rate, the traditional model of what that reimbursement rate, there's lots of things that go into calculating what a reimbursement rate is. And a lot of those things are contingent upon a provider agency having a lot of overhead, having multiple staff members who are going from one home to another, all of these types of things. And so none of those things exist when you're talking about your reimbursement, when you're talking about what you are using your budget for. And so really at the end of the day, you probably come out a little better. But that's why the 10% reduction rate is really to help offset the cost of that FMS vendor. And it doesn't take away from the amount of money that it takes to administer that service because you are now the employer. So and I know I'm saying a whole lot of stuff, and so I know there's probably going to be lots of questions. And please know, this is a lot to kind of take in. And so we can definitely answer questions at the end, but I'm always available too to have more one-on-one conversations if you like. All right, so let's jump into setting a wage. So when you receive your budget, then you'll still decide what hours your person is going to work and what their wages are. And so their wages must fall within a range. And my next slide has that range. And so when you're thinking about those things, about how many hours am I going to have, or how many hours am I going to need, and what do I want to pay them, you're going to want to think about a starting wage and how you may want to give raises over time, how you may pay overtime. So I always just say that to keep in mind, because you certainly can look at your budget and say, this is the amount of dollars I have for the year. I can pay them the max wage and get the hours that I need. But just keep in mind, then that is your entire budget. So anything, if someone calls in and someone decides to work overtime, that overtime increases the amount that is being taken out of your budget, and you may fall a little short. And so the other thing is, if you've hired someone and they're doing a really great job and you really want to keep them, you may want to give them a 50-cent raise next year or a $1 raise next year. And if you're already paying them the max wage, you want to have the ability to do that. So that really is all very personal decisions that you make on your own, that you think through, what your budget is, who your workers are, and what support needs you have. But I always just want to mention those as you're kind of thinking about it, because I don't want you to get stuck in a situation where, you've had to pay a little overtime and then now you have to go without some support, because towards that end of the year, your budget doesn't support the number of hours that you need. So just putting that out there for you to think about. So here is the minimum and maximum wage amounts. And so you will see they vary based upon the service and based upon sometimes the skill level of the individual. And so if you look at, attendant care, for example, the minimum wage is $15 an hour and the maximum wage is $30. So you can pay anywhere from $15 an hour to $30 an hour. So this is really to ensure that you have the ability to have a competitive rate and can compensate your workers as you see fit. So again, this is all part of that self-directed worksheet that I'm going to talk about. There's a tab that says what those minimum maximums are. That's also in the toolkit. All of this information is available to you in all of those resources that we've discussed. And so now let's talk about the worksheet, because this is one of my favorite things, is because I think it's a really cool tool that you can use really just to help you with determining how you can use your money. And so it really helps you know how you can pay, how many hours you can get. And it's a good worksheet to be able, you can just plug in numbers and play and figure out what works best for you. So your case managers all have a copy of this worksheet that they can give to you and will help you fill it out, or they can just send it directly to you. So one of the things that I like to call out in here is, so this is kind of a screenshot of what the top of the self-directed worksheet looks like. So the peach cells are the ones that you fill in. And so as you'll see up here, you can put your planning and start date, your plan start date and end date. So as you'll see, like this is filled in here for an entire year. Everything you do below is based upon those number of months that's up there. So keep that in mind. If you don't put the dates in, it's not going to calculate correctly. The other thing to keep in mind is if your plan year ends, let's say, it's March, let's say your plan year ends in October and you want to start self-directing, like you've got staff, you've decided you want to do this, you want to update your service plan and say, you're like, okay, May 1st, I want to start. You can put May 1st through, that date in October that your service plan ends, and it'll tell you how much you have. And then once that next year comes in, it'll be for the full year. So just kind of letting you know, it'll adjust based upon the number of months that you have in that span up there. And then this is where you can put in your weekly authorized hours. So right here is a screenshot for, this is for the health and wellness waiver. So if you are currently approved for 40 hours a week of attendant care, you would put in the 40 hours a week here in this peach space. And then what your annual budget is would appear right next to it for self-directed. And so this automatically calculates that for you. So it does that formula that we talked about. It does the 40 hours times the reimbursement rate minus the 10%. And so whatever self-directed services you want to do, you can put in your weekly authorized hours there. And then when you go over to your weekly planning, you will see it has a if I pay or if I want columns. So this is where you can say, well, if I pay $30 an hour, it'll show you the number of hours, if I pay $30 an hour, this will tell you how many hours a week you could do with that $30 an hour. And when you put that in, it does calculate those employer costs. So the taxes, workman's comp, those types of things. So that's already figured in there. What I will say it does not figure for you is overtime. You will have to do that yourself. So you'll have to have an additional column that says, and I think I might have a screenshot of that. I do. When I get to that, we'll talk about how you can do that one. But you'll want to make sure that you're thinking about those pieces. So this is a really nice, just quick and easy way you can kind of start to figure out, oh, is this right for me? This is what my budget would be. And this is how, if I want this many hours, then it'll say this is the max amount of rate you could pay. So when you have a copy of the worksheet, you'll want to download it and save a copy, to a secure location. So you'll see at the bottom of the worksheet are all the different types of waivers. So, and then you'll pick which waiver you're on. If you're on the FSW, the Family Support Waiver, you'll pick that tab. And so then it has the correct services and reimbursement rates all built into each tab. And then the reference tab will show you, it'll show all of the services and the reimbursement rates and employer costs and those types of things for you. So it's just for reference, so you can kind of see what those reimbursement rates are and what those other administrative costs are. So that 10%, and then you'll see a 12% employer costs, which is what has been figured for taxes, workman's comp, all of those types of things. And so we've already talked about this part, right? Well, you'll fill out the top right there of the date and the importance of that. So just remember that section is required. And then I kind of got ahead of myself with my slides. I already kind of described some of this, but I'll describe it again just because it can be a little much. So then you'll fill in your number of weekly hours. That annual budget is then calculated and it figures out, it includes that 10% administrative fee, taking that out. So if you have 15 hours of attendant care a week, that makes your annual budget of a year for $24,120.72. Okay, so that gives you a general idea. And then that's where you can go in and say, okay, I have that much money. If I pay $17 an hour, so you'll see or if I pay $17 an hour, you can get 24 hours roughly in a week. If you pay $20 or if you want 20 hours in a week, then you can pay $20 an hour. So it really just kind of shows you what some of your options are. And then down here is where then you'll see that you can, because you most likely may have more than one employee. And so you'll want to think about that. How many employees do I have? And what am I going to pay them? And so here is where you would list each employee. It has a space where you can put their name in. So like here we have Tyrone, who is doing attendant care at $17 an hour for 15 hours a week. That means my weekly cost is $285. So you'll see that, and it says my annual attendant care cost is 14,851. So as you will see, that's where that gives you a little bit of wiggle room based upon what your max budget was to have available for those unexpected expenses, so such as overtime or desired raises. If you put in something and it's more, so say you want to pay Tyrone $17 an hour and you want him to work 30 hours a week, you'll get this warning that says, hey, your annual cost is more than is allowed. And so that's also a nice little feature in here that as you're playing around with it, it'll call that out for you and say, oh, wait, that's too much. You're going to either have to reduce pay or you're going to have to reduce the number of hours. So I know that was a lot. Okay. So, but this is a really great worksheet, again, just to get in and play with and use as a tool, as a spending tool, and really determining what makes sense for you, because the way people, access their services and supports is very individualized, as it should be. So you may just want to do a little bit of respite with grandma in that kind of scenario. You already know she's going to work every Friday night, so you can have a date night and you're going to pay her this amount of hours or this amount of dollars, and it may be a little simpler. But if you have multiple people and you're trying to meet multiple support needs, this really helps you to kind of break some of that down. Your workers, I'll also call out, don't have to make the same amount. So if you have 3 or 4 staff, you may decide that you're going to pay someone who comes on the weekends $1 or $2 more than you pay someone who comes during the week. Or if someone is helping with some overnight hours, that again, you may pay them a little more. So it's really up to you to kind of determine that. So that is one of the other beautiful things of self-direction, is you get to determine, again, who supports you, when they support you, how they support you, and with what amount of money they can support you. So lastly, I just want to talk about terminating self-direction. So there will be instances where people decide, you know what, this isn't for me. I've been self-directing. I don't want to do this anymore. And that's okay. That's totally fine to do that. They can voluntarily discontinue their self-directed services at any time for any reason. So this doesn't mean that services are terminated. It doesn't mean your waiver is terminated. It just means that self-directed service will be taken off of your plan, and it will change back to that traditional model through a provider agency. So don't worry about that. If you get in it and you decide it's too much and you don't like it, you can always go back to the traditional model, and with no problems, right? There are times where people may face involuntary termination, and so those are, if the rules are not being followed. So if, we find that program rules aren't being followed, that people are providing services that aren't allowed under it, that people are being paid who are not allowed to be paid, those types of things. And then what we would do in those instances is those requests for an involuntary termination are determined by kind of a small group committee within FSSA, and they will review all the documentation and they will say, yes, they are no longer able to continue with the self-directed program. And then in order to come back into self-direction, there is a period of time that will have to lapse. It may require that you have a representative if you didn't have one, those kinds of things. So that's also where you want to make sure, that representative is acting in your best interest, right? And I would say, if there comes an instance where you have named someone as your representative and they're not acting in your best interest, and that was unbeknownst to you, we would definitely work through those kinds of scenarios. But really just want to make sure, that people know and understand If those program rules aren't being followed, you could be subject to an involuntary termination of that service. Again, you don't lose your waiver. You don't lose the traditional model. You just lose the ability to self-direct. So no matter what, if you voluntarily or involuntarily exit self-direction, your case manager has to ensure that there are no gaps in your service. They will make sure that your plans are submitted, that they're updated and submitted, and new providers put in place, that traditional model, and really help secure those provider-based services with you. So there still should be no gap in your services. All right. So I've said a whole lot. And I know that's probably heads are swimming. So please let me know what questions you have. I'll stop sharing just for a minute, but if I need to reshare a slide, I can do that.
All right. And Heather, we do have several questions. And
Okay.
thank you. That was actually incredibly helpful. I love the tool that's available. I think that's something that will be really helpful as people are planning. And so let's go ahead and start. How do I screen employees on the self-directed care? How do I find people to work for me? Can you advertise for it?
Yeah. So you can definitely advertise just as you would anyone else, or just as any employer would. So you can do something as simple as reaching out to local universities and saying, "Hey, I'm looking to hire." You could put it on your social media, right? Or if you want to put a job on Indeed, or those types of things. All of those things are available and up to you on what makes sense. I would say when you're screening employees, think about what are those things that are important to you, and ask those questions of them. We know there's going to be a criminal background check, but there's going to be other things around. What kind of experience are you looking for? What kind of personality are you looking for? Those are the types of things that I think you could kind of come up with some interview questions, and your case manager could help you with that as well. And just get a good feel for somebody and know if you jive.
I think one of the other things that people can look into, and by the way, I love the idea of hiring college students, especially. Let's say that you've got your child has speech issues. Maybe that's hiring a speech language pathology student. Maybe it's hiring an occupational therapy student, a special ed education student. Those are great options for that. That way, they're getting potential experience for their future career, and you're getting some additional help that way too. Um, and it's one of the other things that people have talked about is, if there's a particular paraprofessional in school that your child really loves, this may be another way to get some additional hours with them as well. So, can we be sued by the employee if they feel they are unjustly fired?
Well, now you're asking me employment law. And so those are things that I don't know that I can answer for you. So that is part of that employer role that you would need to learn, because you are their employer. And if you fire them, they would probably have the same rights as they do with any other type of employment.
Okay. What happens on self-directed care if you die? Does somebody take over your role? And I think they mean the role as the representative.
Okay. Yeah. Um, Good question, though. So what I would say is that you would want that to be handled as part of any kind of planning that you do, right? And so if you are a guardian, and so you're acting as that self-directed representative, that'll be part of that planning of whoever that successor guardian is that is named would take over that role. Um, if you're not required to have a representative, unless in those situations where they're automatically, because there's a legal guardian. But someone passes who is a legal guardian and another one hasn't come in place, then that person would be in charge of their supports and services until a legal guardian is.
I would also recommend, make sure that you are talking to your loved one's circle of support. Somebody may not necessarily, you may be bringing in siblings who aren't officially the representatives, but you're introducing them to the concepts, you're introducing them to the ideas, and more importantly, you're introducing them to the language and to the people who are involved, because that is all essential as part of that future planning process.
Mhm.
Um, let's see. Does Palco get paid for their services?
So
Yes.
they do. So that's part of that 10% administrative fee that we keep back because the state pays them. So that doesn't come out of your self-directed budget. They get paid a monthly rate to provide that service.
Can siblings be hired as self-directed workers?
Yeah, as long as they meet the requirements of being over 18,
Mhm.
being able to pass a background check, all of those types of things. Yes.
And who pays for the CPR training?
So the CPR training is up to either you as the employer or the employee. So that's part of that hiring process that you'll have to negotiate of who pays for that.
You also shared that workers through that you hire to provide self-directed care, that they'd still need to go through the training program that the state set up for that DSP training. And I know there was
Mm-hmm.
a different acronym, but
HCSP, Home and
yes.
Community Support Professional.
um,
I still say
so
DSP though, so
right.
thank you for calling that out. Yes.
So, but they still have to go through that training too, and
Yes.
and would they also be subject to the registry part of that as
Yes.
well?
Yeah.
Okay.
Yes.
What if a person is 17 but has graduated high school? Could they be a paid worker or even a representative?
No, you have to be 18.
Okay. And if the client is a grown adult, can the parents still not be paid as a self-directed worker?
If the individual is an adult who is self-directing their services, as long as those parents are not a legal guardian, then yes. If the parent is a legal guardian, then no.
And really what it kind of boils down to is making sure that the person who is making the decisions on who to hire is not the one financially benefiting from it.
Yes,
So
exactly.
so that's really kind of what it's about. Um, let's see. Um, how do you calculate the tax withholding amount so I can offer more accurate pay rate to the potential service worker? That's all part of that worksheet that you were showing us.
Yes. Yes, it's all part of the worksheet. It's part of the worksheet. What it does is it takes 12% employer costs. And so that can vary a little bit. Don't ask me about tax law and those kinds of things, but that can vary just a little bit. But that's the average in Indiana to cover workman's comp, insurance, state and federal taxes. So, but that is all figured into that worksheet that you play with. You don't have to figure that part out.
And I love that you guys did that because I will be perfectly honest, that is where, my brain, I get the blue screen of death, error 404, and my brain shuts down. So I am so thrilled that you did that. Um, what is the definition of overtime? Over 8 hours per day or over 40 hours per week?
It's the employee or employer law, so or employee law. So I believe it's 40 hours a week.
Okay. And relatives are able to do this, assuming that they are not the representative chosen. Would they still be subject to the 40-hour limit like they would with services through an agency? Or would they be eligible for overtime?
So you
Sorry, I probably just confused all of that, didn't I?
No, that's okay. I want to make sure I'm answering it right. um, so you have to follow the service rules, right? And so within those requirements, so yes, they would have to follow that 40-hour rule if they fall within those parameters of who is a paid family caregiver to make that 40 hours a week.
Okay. Is medication administration training for employees still required if this is something they have to do? And if so, who will do the training?
So the medication administration training for FS and CIH is part of that online training registry. I know they were working on getting it up, and I believe it is available now. So that's in there, and that's free. If it's a health and wellness and TBI individual, then you as the employer have to train them on your medications. I would also say that's true across the board, though. You're going to, no matter what waiver you are, if you're relying on someone else to give you your medications in that self-directed program, you have to train them on what medications, when, how, and all of those things.
And that's one of the other nice things is if you are the one who is acting as the employer, you really get to tailor that training so that they know your loved one really well. So it's not just it's not just the things like medication management. It's also the little things like, hey, here are the things that they absolutely love. Here's how you calm them down if they're having a rough day. Here are the fun things that they love to do. So it's a little more person centered. What about electronic visit verification? Who will help the employee set this up? This is required for PAC, respite, and residential hourly in the CIH and family support waivers.
Yep. So that's another beautiful thing about self-direction is it's not required for self-directed services. So
Oh,
the
really?
employee on self-directed services is not susceptible to EVV, at least right now.
Okay. And,
I
and
always
let's
say
be
that, at
honest,
least right now. Yeah.
that is a fair point to make. Would this be tax exempt as difficulty of care payments if the caregiver lives in the same household?
Possibly. So those are the things that you would work through with PALCO,
Okay.
um, who to provide that information.
And for those of you who aren't sure what that question was about, if a person who is being paid to provide Medicaid services lives with the person that they are providing the services for, they are exempt from federal income tax on that. So, um, can case managers provide representative role for an adult who is emancipated on the family support waiver?
No, no. So the case management role is very distinct. They should be supporting you. The case manager should be
They
supporting you.
they added a different thing.
Oh,
They added a caveat for their own child. Well, if it's your own
well, you
child, you
wouldn't be
can't be
your
the
own
case
case
manager
manager.
anyway. Yeah.
Right, right.
Okay.
Yeah.
Financially speaking, since you are taking over some of the agency's function, do you get more hours since you're doing extra work?
No, you do not. So the amount of hours that you have been determined eligible for is based upon your support need. And so that is still part of the determination. So you do not get extra hours for acting as the employer. That's just a choice you make in choosing to self-direct.
Okay. How do we find out our budget?
So that's where you would work with your case manager, but you could also uh, play with that self-directed worksheet. If you know how many hours you already get, you can start playing with that, and that'll give you a good idea of what your budget would be.
Okay. I've got half a question here. So somebody typed in, our case managers required to, and then the next part of the question is left off. So if you could update your question, I'd appreciate it so that we can get that answered. Can the non-paid self-directed representative be a family member that lives outside the state?
I'm sorry, I've got an
Oh,
unstable network connection all of a sudden. So
okay.
can you
Uh,
repeat that for me?
sure. Can the non-paid self-directed representative be a family member that lives out of state?
If they're able to perform the functions and the individual is comfortable with that,
Okay.
I would say there's nothing that does not require you to, or does not prohibit you from doing that.
Okay. Um, so if your child is nonverbal and the parent is guardian over the adult child, can I do self-directed care? No, a legal guardian cannot do the self-directed care, correct?
Right. You can't be the paid caregiver, but you could enroll as you could do a self-directed service and pay someone else. You as that parent of that adult child or even a minor, right?
Right.
You would then self-direct their budget. So you would act as the employer of record because you would be the representative. So you can't be paid, but you could still participate in self-directed services, if that makes sense.
Yeah. So the person says, I might have missed it, but how is the budget determined? For instance, if they currently get 12 hours a day of attendant care, would they end up having a budget that would allow for 84 hours a week?
So if they get 12 hours a day, so 12 times 7, yeah.
Mhm.
I just
And
did
you
the math
may,
in my head real quick.
well, and you may
Yeah,
be able to
yes,
make that go
potentially.
even further depending on the payment rate that you choose for your staff.
Right. And that is the nice thing about self direction. So it's based upon, like, this is what has been determined appropriate for you. So if 12 hours a day has been determined appropriate for you, 7 days a week, then that 84 would go into that calculation. And depending upon what you pay, that may end up being 16 hours a day. And then, or it could be 10 hours a day, because if you pay higher, maybe you get less hours. So
Right.
that's one of the other beauties, is you get to determine, where do I need that support and at what time and by who and how much.
You know what? And I think that this is another great opportunity for those individuals who do have higher support needs, where it is harder to find staff members. Being able to pay more gives that flexibility of potentially finding more workers. So, person says, just to piggyback on the question regarding being sued by an employee. Does the financial management services vendor provide any type of liability insurance, like liability coverage, unemployment insurance, etc.? Any assistance or support for dealing with employee complaints? We have families who are very interested in going this route, but are concerned about issues like this. Thank you so much.
So the workman's comp is included in that, and unemployment insurance is included in there. The other thing, so they wouldn't necessarily, um, so they are acting strictly as a financial management agency. So if the employee has questions about the taxes or the things that they're paying, yes, those are the things they would help with. If your staff member is having um, concerns or questions as an employee, those are things you would have to do as the person self-directing.
Okay. Would the case manager or anybody from the Bureau of Disability Services be able to like come in, especially like if there are, if there are disagreements between the employee and the employer to kind of help mediate that or help facilitate some discussions to try to resolve issues?
Certainly, I think they could. Yeah, if that's what the individual is wanting, right?
Mhm.
Who is acting as the employer, if they're saying, hey, I could really use some help, and the case manager says, I'd be happy to help you have that hard conversation, they certainly can do that.
Okay.
What I wouldn't want is the case manager having that conversation without the individual. The case manager is not the employer of record, the employee is, or the individual is. And so, um, you know, as with anything, they can have anybody there to help with those conversations.
Okay. What would you say is the main benefit for someone considering taking on all of this responsibility?
I say it's a very personal choice. And so it is work, right? Because you are acting as an employer and you have to kind of follow and manage your budget. But there are lots of tools there to support you to do that. The benefit is that what I've kind of said all along, you get to hire who you want, when you want, and for how much you want. And um, so that is, I think most people who self-direct, they'll tell you that is the benefit, is they get to be in charge of how they're training their individual, what hours they're working, and what pay they get.
Do we have to pay time and a half for overtime per labor laws?
Yes, you will.
So, as a guardian and parent and DSP, I cannot be staff under self-directed, but I can be with an agency. If I stay with an agency for residential services, can I self-direct respite since as a guardian or parent, I can't provide respite on the waiver anyway.
Okay,
Basically, they're
so
saying, so
yeah,
basically they're what they're saying is, okay, I'm the legal guardian of my adult child. I go through an agency and get paid for residential services.
gotcha.
I can't do that under self-directed care, but since I can't be paid to provide my own respite, can I hire somebody through self-directed care for respite services?
Yes, yes, you
Okay.
can.
If an
Thank
employee
you,
gets
Carly. Wasn't following that one very well. It's late in the day.
I, I was cheating. I was looking at the question.
Okay.
um, if an employee gets hurt on the job, who is covering the medical appointments? Is that through Palco?
So that would be that workman's comp insurance. And so, they would provide you with that information.
What are the documentation requirements?
So the documentation requirements are similar, right? So there's not going to be a requirement for quarterly reporting documentation, but you will want your staff you will want to make sure you have the appropriate documentation to support what they're doing while they're there, and that falls within the service definition.
Yeah. Any suggestions for how self-direction will work for my adult son who is living with and has roommates served by a provider through the traditional method?
So I think it's determining whether or not that is right for him. So if he is in a shared staffing model currently, that's going to be a lot more tricky because you can't do a shared staffing model with self-direction. So if part of how he is getting his support is with that shared staffing model, it may not be the appropriate option for him.
Be-
Um,
Because this is residential services if you're using the hourly rate, not the
right,
daily rate. And that's
right.
something that your case manager can tell you how that's being done, correct?
Yeah. Yes, and some people in the shared staffing have an hourly rate, but I just want to, it's really not going to be probably the best route to go if you're doing a shared staffing model.
Okay. My son requires nursing care each day. Can you hire nursing with self-directed budgets?
You can. So dependent upon, so you can hire, there's respite has the RN or LPN level that you can hire. I will also say within attendant care, especially, we have had a number of individuals who want to self direct who have lots of medical complexities. And so, because it is not going through an agency, they're not held to some of the same requirements. So, some of those skilled care needs can be met through attendant care, through the self directed model. So, it wouldn't necessarily have to be an RN LPN level of staff who comes in. That really is up to you. But if you have someone trusted who helps you regularly and who can do that skilled care, that is something you can pay for through that self-directed option.
Do home health aid hours count as being tax exempt as well for providing for a provider living in the same home? PA hours.
So the PA hours have nothing to do with self-direction.
Okay. I think though what they're asking is are PA hours if the person providing PA hours are living with the individual, would that be tax exempt? You know what? I think that's something that we'd need to do a little bit of research on.
Yeah, yeah.
So um how do we get our self-directed budget worksheet? I was not able to put that link in anything. So
Okay. Yeah, your case manager has the budget worksheet, so you could just, ask them to send it to you. The budget worksheet isn't on our website. There's something weird about putting an Excel spreadsheet that is live and able to be used on our website that I don't know why, but we couldn't get it up there. But so your case manager will be the best person to give that to you.
um I think I understood you to say that CPR training is not covered. It's not covered through the waiver budget. Um,
Right.
but the employer, being the person who's doing the self-direction, could choose to pay for it for the individual, for the employee, or the employee could pay for it themselves.
Yep.
Okay. Um, Are you required to have a case manager? Yes.
Yes. Yeah.
Okay. Um, does a self-directed worker need to have full coverage auto insurance in case of an accident?
So that is up to you as the employer. Um, and I would strongly encourage that
I have
you
to
do.
admit, I love some of these questions because they are things that I would have never, ever thought about.
Yeah. I think
Um,
that's part of too. Those are part of those questions. If it's someone that you are going to rely on to help you with transportation, you're going to want to ask, do they have a valid driver's license? And you're going to want to see that. Do they have auto insurance? All of those things.
is the budget determined weekly, monthly, or yearly? Like, can unused funds be carried over to the next week or month within the service plan year?
So that there will be your budget is your annual budget. So I know we're used to thinking in hours, right? And so this is a little different. The way you get to your budget is thinking through the hours. And so it so that gets translated into your yearly budget. So there's no like moving them from one month to the next or any of that. Your money is your money for the year.
Okay. And so what that could mean is, let's say you've got someone who is a child, and during the school year they may not need as much support as they would need, and would need more support in the summer. You would be able to budget it so that you're using more in summer months than in school year months. Or let's say, your family takes a big, 2-week trip every July. You could take that into consideration when figuring out your budget, correct?
Yes. Yeah,
Okay.
exactly.
Um, so do you recommend that families purchase liability insurance, since it doesn't sound like liability insurance is provided under self-directed care and the financial management services?
Yeah, I wouldn't make a recommendation one way or another. Again, this is self-direction where people they have to do what they think is best for them.
But you know what? Heather can't say this. What I will say is that's something, absolutely, talk to an insurance agent about, to see if it's something that would be right for you, what that would look like, how that all works. It never hurts to have conversations about it. And especially if it's something that you're thinking about, just having those conversations with a professional could be really, really helpful.
Yeah, that's a great suggestion.
If the individual chooses, can employees be paid to be trained by someone else on the team, like a behaviorist, or only direct support services? Hold on. Well, remember that and correct me if I'm wrong, Heather. Anybody who's working with your loved one, whether they are self-directed or whether they are through an agency, should be working with your behavior consultant to make sure that they're up to date on things like, behavior intervention plans and effective strategies for working with the individual. So can employees be paid to be trained by someone else on the team?
So
I don't know if.
training is not paid,
Okay.
right? So if that's what you're asking, is it like when they go through their training, is that paid? Whether that's the HCSP training modules or some of the training that occurs from your behavior support specialist or things like that. No. So they have to be providing that care that is within that service.
Okay. Will TB tests be required?
The same as they are for traditional
Okay.
delivery.
Can you offer benefits to employees like holiday pay, paid time off, and payroll's handled by Palco, correct?
Right. Payment is handled by Palco. That is one of the drawbacks of self-direction is you can't offer paid time off, you can't offer holiday pay, those types of things. But that's where part of that salary negotiation is, you're going to make more on the hour with me. And, you know, um, if that's the route you choose to go, but you're not going to have those types of benefits.
If I pay pack hours and decide to pay my staff $20 an hour when I could pay them 30, what happens to the extra $10 per hour? Do I put that money in a savings account and use it to pay for CPR training or other expenses such as TB testing?
No, so it's just like the traditional model, right? So Whatever dollars go unused at the end of the year are then gone.
Mm-hmm.
And you would start over with your new budget the next year.
Mm-hmm.
The but that's where I say that's where you have to kind of weigh and think about what your situation is, because if you're doing pack and you're paying them $20 an hour and you know that's going to leave you with some money in on the table, that might be a good thing if you have to have pay some overtime. Or if you're like, you know what, things gone really well, you've been really great, I'm going to pay you another hour on the hour, or another dollar on the hour next year. And so, those that's the benefit of having a little extra cushion in there. It doesn't have to be a lot, but having that little bit can make a big difference.
And it can also be that you're just adding more hours. So if you're paying $20 an hour, you could get 3 hours of pack for the same price that you would get 2 hours of pack if you were paying $30 an hour.
Yeah.
So it's about extending that. Um, can the same employee work under an agency for residential services and self-directed for respite?
Yes.
Okay. And last question. Um, hold on. Oh, so this is a very technical question. Pretty sure this is a provider because that's okay. And I'm glad providers are on here too because I think it's important to really understand all of this. They say following up on a previous question, um, does 460 IAC still apply? Which is the only reason I think this is a provider because they said it in those terms. You may not be. You may be an attorney for all I know. Um, for example, providers and employers are required to have proof of valid driver's license, auto insurance, and automobile registration for all employees, education and background checks.
So the background checks are applicable. So the education piece is not, and the driver's license piece it is not, because it's up to that person who is employing the individual to determine if they are going to use that person to help to transport them somewhere.
And we have one more clarifying question. She said, I'm confused. Can you pay for the TB test and CPR training out of the budget, or would that be out of pocket if you choose to cover it?
It would be out of pocket if you choose to cover it.
Heather, thank you so much for joining us tonight. This was incredibly helpful. Oh, somebody has just popped in. Are there resources available from other states that are utilizing self-directed services that can be made available? I'm sure most of these issues mentioned tonight have been experienced by them.
You can always get on every state's website and look at their self-directed program. That was part of what we did when we developed this one is, we just got on other states' websites, looked at their resources and materials, talked to some other states. We had a Applied Self-Direction, which is a national agency who advocates and supports states in building their self-directed program. We worked extensively with them. So there is lots of information out there you can go and find. And on our Indiana site, we have just our Indiana specific information.
Heather, thank you so much for taking the time and for answering everybody's questions. I know this is a new concept for most people. This has been available on health and wellness and the TBI waiver for a little while, but this is brand new to family support and CIH waivers. And I think that this is something that a lot of people are excited about, but also very curious about because it's a new thing. So thank you so much for taking the time and talking with us tonight.
Of course, I'm happy to do it. Thank you all for joining. And again, please feel free to reach out with any questions. I'm happy to help through it.
Ladies and gentlemen, thank you so much for joining us tonight. We have recorded this. We will be posting it on our YouTube channel so you can go back and rewatch parts later on when you need to review. Thank you all so much and have a great evening. Bye-bye.
Enjoy your evening.